Drainage can be interfered with by tumors, so if you get a tumor that blocks maybe the cerebral aqueduct, for example, inflammation, head injuries, meningitis, subarachnoid hemorrhages, cellular debris, developmental abnormalities, any one of these can cause flow issues. Blockages can occur anywhere, but typically if you get a blockage in these passageways, especially for infants, it occurs in the interventricular foramen between the lateral ventricles and the third ventricle, or in the cerebral aqueduct between the third ventricles and the fourth ventricles. Those are the smallest areas. Now, hydrocephalus for infants isn't as bad as hydrocephalus would be for an adult, because remember, for infants, they still have the sutures and fontanelles open. So since the sutures and fontanelles are open, the skull can enlarge, and that's what we see here. Problem is, though, it can only enlarge to a certain degree, and so you still can get dilation of the ventricles and thinning of the cerebral cortex. So this does need to be dealt with, but it's not as, you don't have to deal with it as quickly as you would have to for an adult, because with an adult, it's much more critical for an adult because the sutures and the fontanelles are closed. And because of that, the skull cannot enlarge, and so you get automatic crushing of the brain tissue. And so it can quickly become life-threatening and needs immediate intervention, as blood vessels can be compressed and blood and brain tissue crushed or damaged. And we know what we already mentioned today, the way that this is dealt with is putting a shunt in, and the shunt into the ventricles to drain excess fluid into veins of the neck. It also can be down to the superior vena cava, into the abdominal cavity. I've actually seen it into the pelvic bones, into the medullary cavity of pelvic bones is another place that can be drained and reabsorbed. So there's a number of different locations. So we have CSF flow, we have blood drainage away from the brain, but we haven't talked about how we actually get blood supply to the brain. Blood supply to the brain is through two pairs of arteries. The two vertebral arteries, which become the basilar artery, and the two internal carotid arteries. Through those two pairs of veins, or two pairs of arteries, we're going to serve the brain. We're going to see that the vertebral arteries via the basilar arteries, and you can see here where those vertebrals are coming off. Remember, those vertebrals are going to go through the transverse foramina, then up through the foramen magnum, and they're going to unite at the caudal border of the pons to form the basilar artery. So they're going to come together and form one artery called the basilar artery. So the one from the right, one from the left get together. This vertebral basilar arterial system and its branches are often referred to as the posterior circulation of the brain. So it's going to get the posterior portion of the brain, which includes things like the occipital lobes and the inferior portions of the temporal lobes. And so a lot of times when they talk about posterior circulation of the brain, they're actually talking more about posterior circulation of the cerebral hemispheres. Internal carotid arteries. The internal carotid arteries and their branches are often referred to as the anterior circulation of the brain. The internal carotid arteries supply more than 80% of the cerebral hemispheres. Okay. So how do we get away from the heart and into these blood vessels that are going to serve the brain? So you've seen this before. We're just going to add a little bit, take some areas that we haven't talked about before and add those in. So we go from and which ventricle are we leaving from if we're serving the brain with oxygenated blood?
Left ventricle.
Left ventricle. So we're going to leave from the left ventricle, go into the arch of the aorta. From the arch of the aorta, we have the brachiocephalic trunk, left common carotid, and the subclavian. If we take the brachiocephalic trunk, let's first talk about the vertebrals. The vertebrals are going to come off the subclavian. So if we get into the right vertebral, we're going to have to take the brachiocephalic trunk through the right subclavian into the right vertebral. Right vertebral goes through the transverse foramina, up through the foramen magnum, gives off a bunch of arteries to things like the spine and to the cerebellum, and it's going to meet with the vertebral from the other side to form the basilar at the base of the pons. And then it's going to continue and give its two terminal branches, which are the posterior cerebrals. That's how we're getting to the posterior cerebellum. The other one, so that's right vertebral. What about left vertebral? Left vertebral, take the arch of the aorta, take the left subclavian. The left subclavian gives you the left vertebral up through the vertebral, the transverse foramina into the foramen magnum. Give out the number of arteries, get to the base of the pons, form the basilar, and there we have the right and left posterior cerebral. So now we have the vertebrals. We have the basilar, we have the posterior circulation of the brain. What about the anterior circulation of the brain? Well, that's going to be through the internal carotid. So how do we get those internal carotids? There's one on the right, one on the left. To get to the right internal carotid, you're going to take the arch of the aorta through the brachiocephalic trunk. You're going to take the common carotid. Remember, if you see the word common, it means it's going to split. So you're going to take the common carotid. The common carotid is going to give you external and an internal carotid. The external carotid is going to serve things like the skin of the face. It does not go into the skull. So it has lots of branches that are outside of the skull. Internal carotid doesn't do anything. It has no branches until it gets inside of the skull. So we're going to follow that internal carotid. The internal carotid goes into the skull. Remember that it's going to go up through the carotid canal, turn 90 degrees, get to the foramen lacerum, and take the foramen lacerum into the skull. The internal carotid, its terminal branches are the anterior cerebral and the middle cerebral. There's some on the right and some on the left. Well, how do you get to the ones on the left? You take now the second branch of the common of the arch of the aorta, which we haven't taken before. That's the left common carotid. The left common carotid comes directly off the arch of the aorta. Follow that superiorly. You get to the left internal and external carotid. You're going to take the internal carotid, again, through the carotid canal, through the foramen lacerum, and then you have your terminal branches, which will be the anterior and the middle cerebral arteries. One thing that's very important to remember is that these 4 blood vessels are serving the brain, but they also form a very important arterial anastomosis at the base of the brain. Remember anastomoses? Those are going to be areas where you have blood vessels coming together that then serve an area. So you have multiple blood vessels serving the same area. You can have arterial anastomosis and venous anastomosis. Here we have an arterial anastomosis. And this arterial anastomosis is known as the circle of Willis, also known as the cerebral arterial circle. When you see this circle, this is the circle right here. This is on the base of the brain. We'll look at where it's actually sitting in a second. You can work your way around and see the different blood vessels that are actually part of it. We'll start with the internal carotid. So this is the internal carotid on one side. So you follow the internal carotid to its anterior cerebral to the anterior communicating artery, anterior cerebral on the other side to the other internal carotid. This here is called a posterior communicating to the posterior cerebral on one side, posterior cerebral on the other side, and posterior communicating on the other side back to the internal carotid. So when you look at these blood vessels, these are what are going to make up that circle. You have one anterior communicating artery, 2